Grayson was 4 days old. He required open heart surgery to repair a heart defect. And 4 hours after he came out of heart surgery, they pulled us into the boardroom. And that's when they told us that he also has maple syrup urine disease and hadn't been a case in over 10 years in BC.
Clara was originally diagnosed with strep A. However, her body could not fight the infection and she ended up with sepsis. And finally, a couple of days later, she was diagnosed with leukemia, ALL.
Maple syrup urine disease means that he's missing an enzyme to safely break down protein. To give him more or less would risk brain swelling, brain damage, coma, and death.
We spent a total of 9 days in ICU, and it was amazing. Once she was diagnosed, we saw her health improve immediately.
We've had unbelievably fantastic support.
Every caregiver at BC Children's Hospital exemplifies extraordinary care. We have the most committed staff in our hospital that anybody could ask for.
Our day typically ends in the evening, and sometimes it goes right through to the next morning, but whatever's needed to take care of the patients, we're there for them.
Extraordinary courage means to me the courage to keep coming back and to take one day at a time, one step at a time.
You need to have courage because he's going to need to have courage. He's going to need to be sensitive, but he's got to be tough. He's got to be strong-minded, and the only way he's going to do that is if we have the courage to demonstrate that for him.
Extraordinary spirit means the unexpected love of life and strength.
Once she started back at school, she also started back at dancing. She started doing the activities that she loved before, and seeing her so fragile and get up and dance just made me so happy.
When he was just 4 days old, they couldn't even tell if he already had brain damage. And so to go from that to where we are today it's everything.
Yeah, what he said.
The new hospital, I believe, is going to be extraordinary for many reasons. We'll have space, number one. We've been over capacity for years.
Families will no longer be curled up on a small chair spending the night with their child, but will have adequate sleeping facilities.
We were on floor 2B, but we would have to go down to clinic for different treatments. Now I'm super excited that the inpatient clinic and the children that are going to be admitted are all going to be on the same floor.
I'm really looking forward to operating in a place that has space for all of the things that we need. The smallest room in the new hospital will be what we consider the biggest and the best room right now.
This whole healing environment is such a big focus of our new hospital that is really going to improve a family's ability to get better, to get well.
I think it's going to take everything to another level. Beyond, I think, what people are expecting and what their hopes are and what their goals to achieve are. I think that what will happen is time will go by and we'll all be able to stand back and go, wow.
It's going to be incredible what's going to come forward with the new hospital, and amazing what we can dream to provide our patients with.
I think it seems monumental to try and ponder how a single donation will help. But there's a reason why these kids survive when they didn't before. And it's because of the funding for research, for new equipment, for bigger and better spaces. And the contributions are what make that all possible.
With your generosity, the new BC Children's Hospital will be even better than you can imagine.
Because of you, a new BC Children's Hospital will allow me to do my very best work.
And kids like Clara will be given the very best care.
And families like ours will be happy, healthy, and together.
And that's extraordinary.